Hello, everyone, and Happy New Year. Welcome to our January webinar, Managing Your Parkinson's Medications and Symptoms, sponsored by AbbVie. I'm Donna Greening, Parkinson Canada's Senior Coordinator of Strategic Programs, and with me today is Michelle Dukeman, our Acting Manager, Senior Manager of Knowledge and Community Support. Parkinson Canada acknowledges that we are located on the traditional, ancestral, and unceded territories of many First Nations, Métis, and Inuit peoples. We respect and affirm the inherent and treaty rights of all Indigenous peoples across Turtle Island, and we are grateful to live, work, and learn here. We recognize the need for programs, advocacy, and research by and for Indigenous people living with and affected by Parkinson's, and commit to growing partnerships with Indigenous leaders to develop our understanding and support. To access closed captioning, click on the CC Captions button and then click on Show Subtitle. We're always grateful for the expert speakers who join us to share their knowledge during our webinars. If you have questions about today's topic after the conclusion of the webinar, please contact your healthcare provider or Parkinson Canada's support and information team. There's no need to take any notes during the webinar. We'll be sending everyone a link to the webinar recording along with hyperlinks to resources. If you have a question, please use the Q&A tab found at the bottom of your webinar window or by clicking the three dots for more options. When the webinar ends, please take a moment to fill out our survey that we use to evaluate our programming, ensuring that we're delivering content that's relevant to the Parkinson's community. Now, to kick off, let's hear from Michelle, who's here to share a great new resource that can help you navigate those crucial first weeks when you're starting a new medication. Over to you, Michelle.
Thank you, Donna. Like Donna said, I get to work closely with her, so I know what good hands we are in for these webinars. So thank you, Donna, for all your hard work leading these. Like Donna said, I am the Acting Senior Manager of Knowledge and Community Support at Parkinson Canada. Part of my role is leading work to develop new print and digital resources that meet the information needs and practical needs of folks like you, people with Parkinson's, and care partners. I'm just going to share my screen as I start talking about this resource. But today I'm going to share about a resource that Parkinson Canada launched last year with AbbVie's support. It's called Your 10-Week Guide, Navigating a New Parkinson's Medication. So we often hear from community members like you that starting a new Parkinson's medication can be overwhelming. And it's not just about taking a pill or managing a pump. It's adjusting physically, mentally, emotionally to changes in symptom control, side effects, routine, and daily life. Many people tell us that after a prescription, they leave an appointment with questions, uncertainty, and not a ton of support on how to track what's working and what's not. So, this guide was created specifically to bridge that gap. So, although there are a lot of variations on symptom trackers that exist, there wasn't a practical, structured tool for those first crucial weeks of starting a new Parkinson's medication. It's a period when you're habit forming, there's side effects that are surfacing, and creating a clear picture of for your care team, it really matters a lot. And there also wasn't a tool that combined goal setting, tracking, and tips for communicating with your care team all in one. So this tool is meant to support folks like you, people living with Parkinson's, and care partners, and also the healthcare teams that support you. So it's helping everyone kind of speak the same language and work toward clear goals. So I can share that the guide was developed by Parkinson Canada with people with Parkinson's, care partners, and healthcare providers, including our speaker today, Greta Mah. Thank you, Greta, for your help in the development of the tool. And this ensured both practical and clinical accuracy. It was really critical to have content reviewed by people who understand Parkinson's from lived experience and those professional perspectives. So the guide uses the 10-week period because research suggests that it takes around that long for new habits to form. So for new behaviors to take shape. So like taking a medication consistently or tracking well-being to become habits. So that time frame gives enough structure to see patterns, reflect meaningfully, and adjust in partnership with your care team. One of the core ideas of the guide is that goal setting matters. So rather than just starting a medication and hoping for the best, the guide helps anyone using it define what success looks like for them. So that might be improved mobility, it might be better sleep, it could be reduced off time. It also helps anyone using it track how they feel week by week. And it uses that information to lead conversations with care partners and clinicians. So the idea of goal setting, it makes the transition of this new medication more active, informed, and has the person at the center of the care approach. So I'll share a little bit too about what the guide includes. There's a personal goals section, which includes prompts for setting goals relevant to daily life and well-being. There's also a space to record your goals. There's some communication tips on preparing for appointments and talking with your healthcare team. It also outlines the importance of care partner involvement and how to involve care partners meaningfully. It also talks about balancing daily life, recognizing that there is lots going on to balance in daily life. There's work, there's family, and all those other daily responsibilities. So it recognizes that too. And finally, there's the weekly well-being tracker to help you track your experience with your goals in mind. So it's a structured tracker. I'll go to my next slide to give you an idea of what it looks like. But it's to log mobility, mood, sleep, on and off times, and side effects for each of those 10 weeks, and to map it directly back to the goals that you set at the beginning. It's available in English and French, and it's free for download from Parkinson Canada's website. And there's a couple of different formats. There's a fillable digital version, so you can type directly into the PDF and check off the boxes that are relevant to you, if that's how you like to work. But there's also printable formats for at-home printing for those who prefer paper. And you can also reach out to our support and information team to request a printed copy. So in closure, just want to reiterate that navigating a new medication really is a journey and it's not a moment. So we really hope that this guide gives structure, opportunities for reflection, and a voice back to the person taking the medication and the people supporting them. So thanks for joining us today, and I'm looking forward to Greta's talk. But I hope everyone has a great day, and back over to you, Donna.
Thanks so much, Michelle. Just wait till you stop sharing your screen. Wonderful. So now we're going to meet Greta Mah, who was one of the content reviewers of the 10-week guide. Greta is a board certified geriatric pharmacist, adjunct lecturer at the University of Toronto's Leslie Dan Faculty of Pharmacy, and coordinator of the North York General Hospital Fanny Bernstein Living Well with Parkinson's education program. Greta was one of the consensus participants for the Canadian Guidelines on Parkinson's. She's received multiple awards, including the Canadian Society of Hospital Pharmacists Award, National Commitment to Care and Service Award, and the Coalition of Pharmacists Caring for Aging Canadians Award of Distinction. Welcome, Greta.
Hi, thank you so much for having me. And as Michelle mentioned, like the new year, 2026 is a perfect time to establish new routine and healthy lifestyle to live well with Parkinson's. Okay, so I just want to highlight the objective. And yeah, it's so exciting because like as Michelle approached me about this project and the 10-week guide, and now we're actually using it. So yeah, so love to hear everyone's feedback after trying it out. So objectives for today, I want to provide some practical strategies and how to use this tracking tool to recognize any motor fluctuations and non-motor symptoms, and also to find out if your medication's working well, any concern for side effects, and allow you to communicate with your healthcare team with more details. and also to empower you to set goals to improve your symptoms by establishing a healthy lifestyle and using this track to give yourself some feedback how you're doing and also communicate more effectively with your doctor. So I'm sure all of you know this is Parkinson's affects our brain in terms of uh, affecting those dopamine producing brain cells in the middle part of the brain, sus- the area called substantia nigra. So they lose the function, and by the time you see the doctor and you find um, slow movement with or shaking. So I use the three S's to highlight the motor symptoms. And by the time we see the doctor for these symptoms, like more than 50% of these brain cells are being affected. So the question is, when is the right time to start Parkinson medication? Um, we know the medication is effective to reduce the three S's, the motor symptoms, by providing or maintaining dopamine in the brain. So it's better not to wait too long to start treatment, especially if you have other health problems or older age with concerns or risk for falling or fractures. And also, if you find the symptoms are disturbing, so if someone has very mild resting tremor, that means shaking when you're not using your hand, doesn't affect your daily function, your doctor probably say may wait a little bit. But if you have some shuffling gait or pain from stiff muscles affecting your daily function, you should start sooner. And the other factor we forget is the psychological factor. For example, because of the Parkinson's symptoms, you have more fear of going out to exercise or joining group to socialize because of your tremor or your mobility changes. That really affect you, then you shouldn't wait. I mentioned the link here that Parkinson Canada has a very good sharing about internalized stigma. I found that's very important to recognize. And the other common fear of starting Parkinson medication is, of course, the side effects. But one good thing to know is side effects are dependent on the dosage. So if people wait too long, the symptoms become more severe and higher dosage may be required. At the end, people may have more side effects just from the higher dosage. So another reason not to wait too long. And also the other myth or misunderstanding is losing medication effect over time. So your medication always work. As long as you take the medication, you always have supplies of dopamine or maintaining dopamine. Starting treatment earlier doesn't advance the disease faster. And the other one is the psychological factor. Some people say, if I take Parkinson medication, that means I have Parkinson's, and I'm constantly reminding myself I have this illness. It's common for people to have negative emotions at the beginning of the diagnosis, even denying having Parkinson's totally. But avoiding treatment or ignore the problem doesn't make Parkinson's go away. So it's better to honestly report your symptoms to a neurologist who is familiar with Parkinson's and learn why the treatment is advised based on the doctor's objective assessment. And I strongly encourage people to join a support group or having the one-to-one mentoring through Parkinson Canada to have people who understand you. So in terms of the initial treatment for motor symptoms, the three basic classes are MAO-B inhibitors, levodopa, and dopamine agonists. These medications work by maintaining or supplying dopamine. So MAO-B inhibitors retain dopamine in the brain by deactivating the enzyme that deactivates the dopamine. This medication is the least effective but also have the least side effect, typically the nausea and dizziness. Reserchelin in some study earlier days also found to have some protective factor they found people who start Resagilin earlier seem to have better protection. So we still require further study, but that's the preliminary data. Levodopa is usually combined with carbidopa, known as levocarb, or combined with bensericide, known as Prolopa. It's the most effective medication because it's the only drug that becomes dopamine in the brain. And it's slightly a little bit more nausea and dizziness compared to Resagilin. But it's okay to start with a low dose. And usual starting dose is like half a pill twice a day and gradually increase to 1 pill 3 times a day. And the last group is dopamine agonist, also available as a patch known as rotacotine patch. Its function is to mimic dopamine, and because it's not really providing dopamine, so it's not as effective. And this group of medication associated with a lot of side effects. For older patients, they're more prone to have cognitive decline. So mental confusion is one of the side effects from this group of medication, especially with higher dosage. So that's why it's not recommended for people older than 70 years old as initial therapy. Other side effects include drowsiness, swelling in the leg, and impulsive uh, behavior. So, for example, people may love going fishing as a hobby, but if they cannot stop go fishing every weekend or they get irritated because they don't get to do certain activities, that's considered as impulse control disorder. So it doesn't have to be gambling or shopping or so family member need to be aware if your loved one is on dopamine agonist. The last group is the anticholinergic medication. I don't consider them as initial therapy for motor symptom because it's only helpful for tremor. It doesn't reduce muscle stiffness or slowness of movement, and it's associated with a lot of side effects. Usually is avoided if someone older than 65 years old due to concern for memory impairment. It can also cause dry mouth, blurred vision, problem with bowel movement, and trouble with urination. So we all know about levodopa is affected by a meal or protein. So I love to show this picture. When someone has a big meal, like big breakfast in the stomach, it would take about 2 hours to empty everything from the stomach to the small bowel and being digested. But if you only have one tiny pill with glass of water, and this pill will be absorbed in half an hour from the stomach to the small bowel. So it's so much easier to take your levodopa on an empty stomach and you only wait half an hour, then you can eat anything you want. So for people who complain of feeling nausea from the medication, you may want to take the pill with a little bit of cracker or fruit, like a slice of apple, just to minimize the nausea side effect. But you don't have to take it with a full meal, right? So this way you can have the benefit of the levodopa better and not to be interfere. Now, why protein is a big deal? For example, in this picture, you see the purple. These are carrier allow the levodopa to get into the small bowel. Now, the same carrier also bring over the protein when it get broken down to amino acid. So when we have a limited number of carrier and the levodopa has to compete with the protein, then it definitely reduce the amount of levodopa being absorbed to the bloodstream through the small bowel. So if you have a pill you want to crush and mix with something, you can mix it with applesauce, but not with yogurt or milk pudding that has protein. So people ask, like, doctor didn't specify what time I should take my levodopa. So because the dose usually 3 times a day, So general rule would be as soon as you wake up, you take it, and then about half an hour to 1 hour before your lunch, and also half an hour before your supper to avoid food delaying the absorption. Sometimes the last dose may be require, like the fourth dose at bedtime, if symptoms during the night is bothersome, or some people have toe cramping early in the morning from lack of dopamine. So after years of Parkinson's, some people may notice the medication doesn't seem to last as long. So the reason is your Parkinson always work, as I mentioned, to supply or to keep dopamine in your brain. Exercise is the only way proven to delay the disease progression. But as the disease progresses, the brain is making less of its own dopamine. So you may begin to notice the same dosage of levodopa doesn't last as long. So it's almost like a battery being drained. So we describe that time as being off. So the stiff muscle, slow movement return before the next dose of the levodopa. Some people may even feel a little more nervous or cramping with the toes or the foot. So this picture illustrates what I mean by the on and off. So as you take the pill, the drug level goes up, and once it passes the minimum requirement for the therapeutic window, you start to feel better. And in some people with Parkinson's for many years, I explain a little bit more why there's dyskinesia. Dyskinesia basically means the involuntary body movement. And when the drug level or the dosage is a little too high above the window, then it can cause this unusual involuntary body movement. So your body always eliminate medication just like how you digest food. So over time, the drug level will gradually reduce and until the next dose period. So it's almost like a roller coaster. You're going up and down as the Parkinson's disease progress. Now, everyone's experience different. Some people really notice this yo-yo effect, but some people may not notice as much. But our goal is to monitor so that you can tell your doctor how you're feeling. So with your 10-week guide, you can take a look at the mobility. So for each day of the week, you look at the morning, afternoon, and evening, and then you can report since the time you saw your doctor, if there's any change. Is it better or worse? And when we look at the mobility, so you reflect through your day, um, do you find it harder for you to turn around or experience the most muscle stiffness or slow movement, shuffling gait, or even moment feeling more freezing? That's like your feet feel like being glued to the ground. And that's more in a later stage of Parkinson's. So you can mark down X or um, double X for a lot worse. And I also like to um, incorporate that with the off time. So down at the bottom page, you see the off time. So you circle how many times you take your medication. So for example, if I'm taking the pill at 7, 12, 5, and 10. So these are the 4 times I take my medication. And it's important to keep track when you have your meals. Ideally, if you have a consistent meal time, that will be easier. So that day my, I have my breakfast at 8, lunch at 12, dinner at 6. And that day I noticed around 12:30 to 1:30, my medication didn't seem to kick in. So normally when I take my 12 p.m. dose, I feel better by 12:30. But on Sunday, I still don't feel the benefit for the medication. So I put an X there. So I keep track of the time. So because I have my lunch at about 12. So I wonder maybe I have my pill and lunch around the same time. So I have um, noticed the delay on the benefit. So I write down when I have the symptoms and highlight my pill time and my meal time, then help me to figure out what may be happening. And then on Monday, um, I notice um, I have some off time period that my symptoms come back in the evening as well. So both Sunday and Monday in the evening, before my 10 o'clock dose, I already feel the symptoms. So the time you feel these symptoms is important. So what to do when we have so-called delay on take more than an hour to work? So make sure you take your pills on time, um, and also having empty stomach, and also to manage constipation, because a lot of time the constipation is related to slow movement of our intestinal tract. So when the colon is not moving, it affects our small bowel, so the pill doesn't get absorbed properly in the small bowel. And it's important to take with a glass of water. And some people find if it doesn't work fast enough, chewing one of the tablet may be helpful. So constipation can be relieved by having fluid during the day and fiber in your diet. But it's also important to monitor if it's not improved. Uh, Constipation can lead to poor appetite, and in severe cases, it can also lead to twisting of the bowel, even bowel obstruction. So it's important to have daily exercise. And some people find a gentle abdominal massage, um, probably not right after you have a meal, but maybe early in the morning, before breakfast, while you're sitting down or lying in bed, you can do a gentle massage. And also, not to do the abdominal massage if you have any abdominal pain. Restore legs tend to improve hard stool. So when you look at the Bristol stool chart, type 1 and 2 indicates constipation. So having restore legs mixed in a glass of tea or coffee in the morning is very helpful, or liquid. And also make sure you drink enough fluid during the day. And if it's still not sufficient, no bowel movement on a regular basis, you may want to add Senokot at night or adding other suppository. So when you go back to your mobility diary, you find your off time happening at night. So we want to figure out how to resolve the wearing off. So it depends on how often this happens. So in our case, it only happened during the nighttime between 9:30 to 10:30. So we have a few options. So we may increase our 5 p.m. dose with a little bit more levodopa, or add entacapone to extend the levodopa benefit beyond 9:30. So you can see the 5 p.m. dose doesn't last until 10 o'clock. So the doctor may help you to analyze what's going on and may suggest either increase a little bit of the 5 p.m. dose or adding entacapone. And if the wearing off happen to other times through the day, not just during 9:30 to 10:30, the doctor may increase the dosing frequency. So we may have levodopa 5 times a day, or adding resergyline to retain dopamine, or for younger individual, may also add dopamine agonist. Now, if the symptom recurring during the night, for example, it happens during like 2, 3 in the morning or early in the morning, the doctor may add a CR control release at bedtime. So what exactly is entacapone? Entacapone is a drug basically to prevent the enzyme for breaking down levodopa. But without levodopa, entacapone has no benefit. It doesn't have much side effect other than the harmless orange discoloration in the urine, and better not to bite the pill because that can make the teeth turn orange as well. So swallow the whole pill with a glass of water, and the major side effects, watery diarrhea, and tell the doctor if that's bothersome and need to stop the medication. Now, I mentioned a little bit earlier about dyskinesia. So with that motor fluctuation, when the medication's a little too high, the dosage, it can cause a bit of a jerking movement or arm twisting. Usually it's not problematic unless it's very severe. It can affect the balance and increasing risk for fall. It tend to happen to younger individuals with Parkinson's for many years or with recent weight loss. And by maintaining the same dose, your body still sends like, oh, I'm having too much levodopa. So when the levodopa level rises to its peak about 1 hour after taking the pill, that's usually when the dyskinesia happens. So this is due to the unnatural pulsatile dopamine stimulation to our brain, which is so deprived of dopamine. So it's like a temporary overstimulation. So the involuntary body movement can be more prominent uh, during this period, and especially when someone feeling anxious, the tremor or dyskinesia can happen more. So a way to reduce dyskinesia is to reduce the dose slightly. Sometimes the doctors say reduce by half a pill or increasing the interval by using the dose fractionation. So instead of taking 2 pills 3 times a day, the doctor may advise you to take 1.5, 4 times a day to even it out. So if necessary, the doctor may add a low dose of amantadine, as the medication may need to reduce dyskinesia. We try to avoid high dose because it can cause hallucination, confusion, especially someone with older age or concern with cognitive decline. It can also cause the red skin blotches on skin, especially on the leg, causing trouble with urination, constipation, and even sleep problem if taken at night. The drug should not be stopped abruptly. It has to be gradually tapered down by 25% every week. So if a lot of fluctuation happening, then the doctor may try to provide another option of treatment, such as the levodopa intestinal gel is through a tube inserted to your small bowel directly, or by having the levodopa in the form of false levodopa infused under the skin. So this strategy is to provide a more normal physiological way of delivering dopamine to your body. So our 10-week guide, besides checking the motor symptoms, we also try to track many other non-motor symptoms. But each person is very different. The more we learn about Parkinson's, we realize it's actually a multifactorial disorder. So based on the genetic factor, environmental exposure, our natural process of aging, each person is different, and also changes with our cellular function, whether it's the mitochondrial breakdown or the abnormal buildup of the alpha-synuclein Lewy body or oxidative stress. So that lead to Parkinson's with many different phases. So I use a picture like different breeds of rabbits, even though they're all called rabbits, but it's very different. So Parkinson's presentation in some people may be more tremor and feeling anxious. Some people may have more dizziness or more stiffness. Some people have more sleep or mood problem. Some people may have more bowel bladder function problem. So each person can have like different combination of non-motor symptoms. So that's why we use this track to identify these motor symptoms, because if you don't um, notice them, don't mention to your doctor, then they never get treated. So by using this booklet, so we can measure, for example, like if you feel occasional dizziness or lightheadedness, you may want to purchase a blood pressure monitor. And during the time you notice the symptom, you record it happens in the morning and my blood pressure, we have to check it sitting and standing. And if I notice my standing blood pressure is much lower, and that's something that we definitely need to present to your doctor, because Parkinson's tend to cause orthostatic hypotension. That means when you're in a lying position, you feel fine. But when you stand up, because of the gravitational force, the blood will flow to our legs. So the blood pressure drop as we're standing up and make us feel dizzy and even more brain fog, difficult to think, and having more risk for falling. And if you're on medication that lower blood pressure, such as heart medication, blood pressure, or use Viagra type of medication, and including all Parkinson medication that can also lower blood pressure. So we need to monitor your blood pressure. The best time is about 1 hour after your morning medication, so we can see the effect. And if it's always low, it's better to have a big glass of fluid before you get up in the morning, so to prevent the dizziness when you try to get up. And also, if you sit for a while after watching TV, you may want to flex your ankle to pump blood back to your circulation. So if the drop of blood pressure is very severe and always causing the dizziness feeling, you may want to wear abdominal binder. They can purchase online, or some of the worldwide store, they carry the abdominal binder. And some people may even use like a back brace, treat it as abdominal binder. So you wear that before you get up and to retain the blood in your abdomen, in your tummy, instead of dropping to the leg. If more severe, your doctor can prescribe medication to help raising the blood pressure. So besides blood pressure, we also want to monitor our appetite. Just for medication, or you feel full easily that you don't feel like eating. So you may want to monitor any bloating, how's your bowel movement, use the Bristol stool chart to monitor, and the frequency, because constipation definitely affects your appetite. Now, Parkinson's also affects the balance of our brain chemical to regulate our mood. And this change is very gradual, but it's important to ask ourselves, how am I feeling? Especially talk to your loved one in your family. Do you find my mood is a little low? How am I doing lately? To be open to talk about your emotions. Depression can be described as like loss of appetite in addition to, not everyone have loss of appetite. So the symptom can be very different for each individual. Can also affect your sleep, your energy level, your motivation. Do you feel like doing things that you enjoy? Other than feeling overwhelmed or sad, sometimes we feel hopeless. And the other emotion can be anxiety, with the constant worries or fears, or overthinking the worst case scenario. This can happen to people when you first got the diagnosis, start worrying about the future. And what if I cannot look after myself? Or would people look at me? Would they stare at me? um, like a lot of uncomfortable feeling when you didn't tell anyone about your Parkinson's, and you may tend to overthink the scenario. So again, that's why it's so important to connect with the Parkinson community. So the symptom um, in public may be affecting you more when you feel anxious. And sometimes feeling anxious, as I mentioned, can worsen the tremor and dyskinesia. Panic attack can make our heart rates go faster, even occasional shortness of breath. So it's important to notice when that happens. Now, antidepressants boost our brain chemicals, give us more serotonin or norepinephrine. So different antidepressants is useful for different mood symptoms, but it takes a bit of time for noticeable benefit. So it's important to get noticed, treated earlier, and along with counseling, psychotherapy, support, avoid social isolation, you get much better improvement. Apathy is not about depression or anxiety. It's basically lack of emotion and also lack of motivation. So it's quite tricky. Family usually is the one who notice the change in behavior, personality. It's important for family to mention it because it's often mistaken as being lazy. We know exercise is good, but the person doesn't feel like doing it, completely flat and kind of like, oh, I don't care. So that's considered as apathy. So it will reduce desire to show affection, to socialize, in some cases, even self-care. And family often feel stressed when someone has apathy. So the strategy is important to understand what's going on to make sure the individual is not having sleep problem. That's why they're fatigued. To set meaningful personal goal and start small, and always encouraging the individual who try, putting the effort and explore interests, things that meaningful, and having bonding relationship and having a schedule to incorporate physical, social, and cognitive activities. That's very important. So we monitor our sleep. Is it easy to fall asleep or do I stay in sleep? Do I wake up frequently because of a bathroom visit or do I have restless leg? Um, do I worry that's why I'm not sleeping well? And do I have a routine? It's good to have a routine to go to bed and wake up the same time. And is my energy good, poor, or okay? So it's good to have a habit. Um, Make sure you don't watch a lot of TV or use your phone because the blue light really affects our sleep. And also identify any sleep problem. If you wake up with dry mouth, headache, or very tired during the day, and especially you have snoring, it's good to check out, make sure you don't have sleep apnea because sleep apnea alone can worsen Parkinson's and cognition. Some people may be talking or acting out the dream, and it's important to have a bed rail to make sure you're safe and not falling off the bed. Melatonin is very helpful. In fact, there's a study found people with Parkinson's naturally have less melatonin. So using the time release help you to maintain a good sleep through the night. And treatment for restless leg, make sure you check for iron deficiency. Some people find magnesium biglycinate helpful, and having massage, muscle rub is important. If frequent urination, make sure you check for any prostate or overactive bladder. Mirror background is very helpful for overactive bladder. So keep track of your exercise. As I mentioned, a New Year resolution. So write down things that you do, you enjoy, and it's a good empowerment tool that when you connect with people, that's also very helpful for our cognition. So people have concern about cognition, but we know good sleep, exercise, social interaction, and playing word game. Because like when we communicate, we use different words. So when you have a word game, start with like A, B, C, D, and using a dictionary, keep all these words fresh in your brain. That really help prevent word finding problems. So we ask ourselves, any change with my planning? Do I have trouble like finding my way? Or even practice driving without using the GPS. Like look at the map and then see if you can navigate, right? Or um, try to um, cook something different using a new recipe or doing things using a different strategy, um, or just having more social time interacting with people. So assess yourself whether the change with cognition impact your daily life. So only if it's severe, the doctor would consider prescribing medication if it's really impacting the daily function. But otherwise, for the mild cognitive change, we just make sure we keep up good sleep, exercise, as I mentioned again, the social interaction and word game. So with medication, we may want to go to the everyday victory counts for more details.
That was such fabulous information, Greta. Thank you so much. We've got lots of questions that are being submitted, so we're going to get right to them. We're going to start with a couple for Michelle. Michelle, we've been asked, should the specific times of pills and meals be recorded in the weekly tracker, like Greta showed in her slides? And is there a spot for that?
Yeah, in the weekly tracker, there is a spot for your medication doses, and then for meals, there's a extra notes section where you can kind of customize anything else you'd like to add. So you can add meal timing there too, if that's something that you'd like to put in there.
Great. Greta, is there anything you wanted to add for suggestions on tracking that?
Yeah, I think it's better to have regular meal time and medication time, but anything a little bit out of the ordinary. You know, when you have friend visit, then maybe on that particular day, you want to make a note.
That's really
Yeah,
good
good point.
advice. Yeah. Michelle, another question for you. Is it possible to customize the form to track medications if you're taking them 6 times a day, for instance?
Yeah, so the doses go up to 5 on the PDF fillable form, and that was just because if we went any bigger than that, it was going to be too hard for anyone to track. So, but a workaround would be if you do have doses 6 times a day or more. On the website, there is a document that only includes the weekly tracker document that you can just print at home. So you could print additional copies of that, and then you can go beyond the 5 doses that the fillable PDF online is limited to.
Thank you. All right, Greta, we've got lots of questions about medication timings. So
Yeah. Oh, one quick
how
thing to
important?
add. Oh, sorry. If
Sorry, go ahead.
if medication is required for more than 5 times, you may want to talk to your doctor like other treatment because we're talking about infusion, subcutaneous infusion. Yeah, so anything more than 6 times, 7 times, maybe consider those options.
Super. All right. So, question about medication timing. How important is it to avoid eating protein and take my medications at set times during the day? And is there an optimum amount of time between having the meal and taking the levodopa carbidopa? I know it was in your slides, but maybe you could just hit that home again.
Yeah, so the picture I want everyone to remember is when you only have a pill, nothing else in your stomach, it only takes about half an hour to be absorbed. So important to maintain the empty stomach and half an hour. And then after that, you can eat anything you want. So make sure that half an hour window is open. That's the minimum. So half an hour to 1 hour is the ideal.
Thank you. So we had a couple people asking about if you have to go into the hospital, what is a reasonable accommodation for medication timing? Because they don't usually give it to you exactly when you're used to having them. And someone else is asking specifically, like if they know that they're having a surgery coming up, do you have any tips on adjusting their medications leading up to their surgery date?
So For pre-scheduled surgery, usually they have an appointment to see patient before surgery, and that's the time you bring them the list. Here's my medication, and here's the time for my Parkinson drug, and it has to be on time so that they will make notes of that. Usually before the surgery, they say, uh, within that window that's not supposed to have food, but you can still take your pill with sips of water. So check with your doctor before surgery. Now, for emergency, no one expect the need to go to hospital, but make sure you bring along your pill to emergency room because by the time the doctor see you, prescribe the drug, and then give you the drug, there's like many hours of delay. So before you dash out the door to emergency room, grab all your Parkinson pills and take the pill according to your home schedule while you're waiting in emergency room. And make sure you tell the nurse that I have my pills, don't worry. Yeah, so in emergency room, try to take your own pill at your home schedule as long as possible, unless the nurse that or doctors there say you're not allowed to, then you deal with that. But yeah.
Okay, great. So someone has asked, what is the best option if you've missed a dose of medication or like by forgetting it or other circumstances where you couldn't take your medication?
That happened, but if it does, take it as soon as you remember. But if it's so close to the next dose, then skip it. Don't never double up the dose. You may want to take the next dose just a little bit earlier, kind of like gradually even out that gap. Yeah, so the best is to use your phone. Now we have the smartphone that set multiple alarms.
Mhm. So for people who are new to taking Parkinson's medication, can you explain what could happen if you do double dose?
If you do a double dose, then you may feel more nausea, dizziness. For people who have Parkinson's for years and with dyskinesia, they have way more involuntary body movement. Yeah, so everyone's different. So just definitely when you double the dose, you double up the potential side effects.
Super. Question, someone is asking if you have any recommendations for modifying the timing of medications if they're going to be traveling across multiple time zones.
Yeah, that's a really good one. So I have my answer in my PDF that I'll send out. Depends on the time zone you're going to. So, for example, I use if I'm going to UK, 5 hour time difference. So the day when I'm traveling, I would take my pill as my usual time. And then when I arrive, I still treat that evening as my Canadian time. But the next day, after I have a good night's sleep, I wake up, and the time I wake up, and that's when I take my first dose, and I stick with my dosing interval, not paying attention to the local time yet, because it likely take me a few days to really have my body adjust to local time. So
Mhm.
I would say during the adjustment period, I would take my first dose whenever I wake up, because sleep is the most important. So don't adjust your waking up time for the pill, but have good night's sleep when you're traveling. Whenever you wake up, you take your first dose and then you follow your dosing interval. And the next morning, you may wake up closer and closer to the local time. And then eventually you get the right time at the local time.
Great, thank you. Okay, next question is about symptoms. Um, I know that you've explained about constipation, but someone's asking if you have chronic constipation that could be caused by the Parkinson's or the medications that they take. Are there any additional strategies that you can suggest? And Parkinson Canada does have a bowel management program that's outlined in our fact sheet, Constipation and Parkinson's, and we will share a link to that. But is there anything that you can add for someone who's dealing with chronic constipation?
So basically, the three groups of Parkinson drug that I mentioned, they do not cause constipation, but Parkinson's disease itself will slow down our guts. So sometimes you'll find a lot of may not help because when your movement is so slow, it just sit there and become dry. So that's why the Bristol stool chart is so helpful. You know what you're dealing with. And when you see dry stool, then the stool softener, as I mentioned, the Restore Legs is very helpful. And physical exercise and also the abdominal massage, very gentle massage, can help the motility. Yeah, some people find having a low stool to raise your feet when you're in the washroom. By raising your feet can kind of make it easier for bowel movement.
Great. Okay, we are being asked, and I know that it affects some people with Parkinson's, where you have like a constant drippy nose or sinus issues. And so someone is having that issue, and they're asking if you have any strategies, and they're saying it's a constant problem for them.
Yeah, I do see a lot of people have that. And the disturbing fact is when they eat and the nose start running. Yeah, so there's many reasons for runny nose. So if it's like allergy, um, then try the allergy medication and see if that helps. Or sometimes the steroid spray like a Flonase, like those may be helpful. But if the individual try allergy or steroid nasal spray not helpful, then may consider having a petroleum. So talk to your doctor because there's some study found Parkinson's can affect our nervous system within our nose, the autonomic nervous system controlling the drip can be a problem related to Parkinson's. So the ipratropium, the brand name is Atrophin. It's Atrovent. The Atrophin nasal spray may be helpful.
Great. Thanks. I just wrote that down really quick. Question for you about energy levels. So, a couple people have asked a couple different questions, and I think maybe they could be answered together. Someone says they're currently taking 24 levodopa carbidopa pills daily, and they're still running out of gas if they exert themselves. And someone else is saying, is there anything that they can take for a boost before they do their exercising? Have you got any tips for energy levels with medication timing?
Okay, so maybe I'll deal with the boost before exercise. Some people find having a small can of like Boost or Ensure protein before exercise, before the workout, or also having a bottle of water. That's important before you exercise because exercise tend to require more calories. Now, for the first question, the individual is on 24 pills. So remember, one of the side effects is low blood pressure. So the way described running out of gas could be like the weakness, fatigue because of low blood pressure. So I'll check the blood pressure, make sure it's not low. And the other one is fatigue could be due to poor sleep. So make sure the night sleep is good, like no concern from restless leg, pain, or sleep apnea, uh, or REM sleep behavior. So make sure your sleep quality is good. Parkinson drug usually doesn't really boost energy, but having more daylight. So especially now in the winter season, so having more exposure to daylight, exercise, uh, gentle exercise really improve the energy level. Yeah, so make sure your blood pressure is not low. That's the common problem that I see.
Okay. Now we're running out of time. Are you okay with staying a few extra minutes to answer a few more questions?
Sure, yes.
Okay, so someone's asking, well, there's lots of questions about supplements. So we've been asked about mu, I'm saying it wrong, mu, mucuna pruriens to manage
Yes.
symptoms. Are there advantages or disadvantages to that product?
Okay, so a lot of people ask about that. It's basically like a broad bean, like fava bean, that supply this so-called natural levodopa. The issue is it doesn't come with the second ingredient. So when you take your Parkinson pill, it comes with carbidopa or benseroside. that minimize the side effects of dizziness and nausea. So when people just have this natural beans or powder, they don't have second ingredient, this concern for the side effect. And also the second concern is um, even you buy it through online, they say like, oh, so many milligram equivalent to how much levodopa. There's a paper they found, they studied different brand, the quantity doesn't really match. So they claim there is so much levodopa. Some of the sample have like 20 times higher. So it's really difficult for you and your doctor know how much you're getting. So it's more the quality control is a little bit tricky.
Okay, that's good to know. Thank you. Someone's asking if it's safe to take levodopa with herbal tea.
Herbal tea, if something like basic like chamomile, and usually there's no concern. Um, any tea that has a bit of caffeine actually make the drug work a little faster. So green tea it still has some caffeine. But other than that, like they should be okay to be taken together.
Okay. So here's an interesting question. Someone's asking if they're taking Brasagiline. They know that it says to avoid taking tyramine-rich foods like soy sauce, aged cheeses and meats, tap beer, and red wine. But is it safe to consume a small amount of these?
So good news is uh, considered as selective MAO-B inhibitor. So basically, unless the dose is way above beyond the recommended dosage of zero point 0.5 to 1 milligram, typical dosage, it should not cause a problem because uh, this medication is very selectively inhibits the MAO-B. It didn't inhibit all the rest of the MAO enzyme. So anyway, the long story short is accumulation of tyramine should not happen with regular dosage unless you consume something is like super high amounts of tyramine. For example, like the miso soup or the Stilton blue cheese, like aged cheese, or you drink not dipping, but drinking a lot of soy sauce. We're talking about like more than 30 mil, that may be a concern. But if you're just using soy sauce for cooking, a small amount for dipping, there's no problem at all.
Okay, thank you. Question about side effects. So, how many days should someone give a new medicine if it's making them feel dizzy or off?
Depends on how severe. If just like a little bit, the self-management strategy is like drink lots of fluid. And some people find when they lie down for a while, they feel better. So the best strategy is actually talk to your doctor and maybe break down the dose to a smaller amount. So for example, if your morning dose is a problem, instead of taking one pill altogether, you can break it to half a pill and then another half a pill 1 hour later and see how you feel. But talk to your doctor. If it's mild, that should be fine with more fluid and maybe a little bit of salt in your egg or breakfast. But if it's problematic, don't wait. Let your doctor know ASAP as soon as possible.
Great. Now, speaking of salt, someone's asking about blood pressure, and they're asking if certain Parkinson's medications are more likely to cause blood pressure issues, or are certain people at a higher risk of developing orthostatic hypotension?
All Parkinson medication can lower blood pressure. Older individual or people who are on heart blood pressure medication, or if they have diabetes or many years of Parkinson's, experience the orthostatic hypotension, the one that when you get up, the blood pressure drop, uh, those considered as orthostatic hypotension. Yeah, so not everyone have problem with blood pressure, but individual with this condition should be more careful.
Okay. Question about medication dosages. When medication is increased, how long would it normally take before the body gets used to it? and is no longer effective, necessitating a dosage increase.
This is a very common myth, but this is totally wrong. Your body would never get used to it, and the pill will never lose the effect. As I explained, Parkinson is a slowly progressive condition. So it's over time when our brain is not making its own dopamine, then your body require more supplementational dopamine. So how long does it take when that happens? So number one, do regular exercise. Physical exercise delay progression of Parkinson's. So I would say at least more than half to 1 year, 2 years before the doctor need to increase the dosage. So everyone is different. Um, so the key thing is to have a good lifestyle, good sleep, good mental well-being, social interaction. When you enjoy exercise, live well, your Parkinson's progression is delayed, then you don't need to have more medication.
All right. Okay, two more questions. Is there a maximum amount of levodopa carbidopa that can be taken in one dose? They're worried about either overdosing or developing side effects.
Yes, the higher dosage, more side effects. But each person is different. There's no maximum dose per se. But for people who have concern for dementia, hallucination, like seeing things that's not real, the dosage increase has to be very gradual. So a sudden increase can cause more mental confusion. There's no maximum dose. Most people start off like half pill, increase to one, and then very gradually increase to two. And then I think three is pretty much the highest dose I see. I don't think I have seen 4 pills, but doesn't mean it should not happen because everyone is different. So the higher dosage, that means more risk for side effects like dizziness, nausea, um, and concern for men in some individual. So it's very depends on individual. Yeah, so that's why other treatments available, we're talking about the continuous infusion, then you don't need to have like high dose and so many pills.
That was actually the next question I was going to ask you about alternative therapy. So I know you've mentioned like the pump therapies that either deliver the medication under the skin, and there's also a pump that can deliver it right to your small intestine to bypass your stomach. Would deep brain stimulation also help reduce the need to take as many pills?
Yes, it does reduce the requirement of your medication. So it's another option to explore.
Wonderful. All right. Well, that's all the time we have for questions. And thanks to everyone for asking such thought-provoking questions. And of course, a huge thank you to Greta for all the great information. Watch your email inboxes for our follow-up email that's going to include a link to a recording of this webinar and resources and links mentioned here today. Greta also went through some of the questions that were pre-submitted and has more fulsomely answered some of the questions, so they'll be included with our follow-up email. We also hope that you'll join us at our next webinar, Women in Parkinson's, Raising Our Voices for Change, taking place on Wednesday, March 18th from 2 to 3 p.m. Eastern, where we'll hear from neurologist and clinician scientist, Dr. Veronica Bruno, about how women experience Parkinson's symptoms differently, the disparities in equitable care access, and her current research findings. We'll also meet acclaimed author Kathy Page and chat about her memoir, In This Faulty Machine, where she reflects on a creative life well lived and explores the physical realities, philosophical questions, and ironies of living with Parkinson's. Watch your email inboxes for more details and a registration link. And if you want to pre-read Kathy's book, a list of where you can order a copy will also be included in the email. And as always, when the webinar closes, we hope you'll take a moment to fill out our short survey. It helps us plan programming that's relevant to you. On behalf of all of us at Parkinson Canada, I'd like to thank you for joining us, and I hope you enjoy the rest of your day. Take care.